much. Pleasure to be here. I am going to differentiate between patient engagement and sustainable behavior change, which implies a longer term of engagement for patients. And I'm going to use my company Medisafe as the case study as I walk through these 5 guiding principles. So first, to make sure that we're all grounded in the same statistics, this is a huge, non-adherence is a huge healthcare cost issue. It's $300 billion a year in the United States alone, which is about 10% of the US's healthcare costs overall. It is also a huge quality of care issue. It leads to increased mortality as well as increased hospitalizations. Every 4 minutes, a patient dies from non-adherence. And so I'm going to talk about what our solution is, how we position ourselves, and then I'll walk through these principles and you'll see how we got there. So what is Medisafe? Medisafe is a patient-centric, personalized medication management platform addressing all major causes of non-adherence. The first rule or guiding principle for us was to be patient-centric. And now this is a very popular, in vogue term. I'm going to describe what it means to us, and I'm going to spend more time on this rule than any of the others. Patients are individuals, and non-adherence is a complex problem. And for every patient, it is a different problem. It is a different underlying factor that causes them not to take their medications. Forgetfulness is a big one, but it also includes lack of motivation, lack of support, cost of the medications, fear of putting a chemical in your body, etc. We have a very inspirational, uplifting tone. We talk to patients about getting in control of their health, getting on top of their medications. There's this inclination in healthcare to be very functional when you develop technology. We took a different path. And so we also thought about what is the most common, frequent interaction or touch point we have with our patients, and we sought to make that approachable and personable. And the audio file didn't play, but that's fine. So we call these med tones. It's a personalized reminder. And we have Austin Powers, which you didn't hear. We have Elsa for kids, Minions, Donald Trump, Hillary Clinton. And our patients can set their own reminder type. And this is our CTO and our chief architect. And really being fun and having that it has to be ingrained in your culture. And so this is a video that we reply to every Twitter, every tweet that is a positive review of Medisafe. We thank them by jumping for joy. We also have a very dynamic user experience. Again, it's about personalization. And so when someone adds a medication, we start to understand what medication they're taking, what conditions they're managing. We also learn how they're interacting with the platform, and we serve them a tailored experience uniquely to them. An example of this is if a patient's adherence falls below a key threshold, say 80%, then we can automatically insert a card into this feed that says, call your nurse, here's the phone number, and talk to them about why you're having trouble with your medication. Serving patients also means serving those that are close to them, that are responsible for taking care of them. And so we have a feature in Medisafe called a Medfriend. And when patients add Medfriends on Medisafe, which essentially means that they're monitoring their care and they're being notified if they miss a dose, 71% of the time, patients increase their adherence even more. Rule number 2 is be bigger than an app. We want to be device agnostic. We give patients choice. So you can see the Apple Watch on the left. There's a connected pill cap that retrofits on 90% of pill bottles in the United States. And it notifies Medisafe when the patient takes the medication. Be interoperable. We know we have a fragmentation issue in healthcare. And so in addition to enabling patients to enter their medications one by one, we enable them to import their meds from major pharmacies. This one might not be as readily apparent, prove clinical significance. You'll understand as I go through rule number 5. But we've done studies at Medisafe to show that it works as advertised. So we've mapped our patients' data to claims data, and we've seen higher MPR, medication possession ratios. In this particular case, for hyperlipidemia, 20% higher amongst our patient population after 6 months versus a control group. And the reason you do that is to connect back to providers, because we know doctors love data, they want proof, they want validation, clinical validation. And so I've seen a statistic that says patients that are not interested or can't afford mHealth would be inclined to change their mind 50% of the time if the doctor endorses or recommends it. And so just quickly, some of the results that we've seen by following these principles. We're approaching 3.5 million users after 3 years, 4.5 stars out of 5 in the App Store with 130,000 reviews. We have a net promoter score that's similar to Zappos. We've seen 450 million doses taken correctly on Medisafe in the last 3 years, 60 million user sessions a month, and the average retention, although of course we want to improve upon this, is 6 months, which is quite good when you think about mobile health and digital health engagement. Thank you very much.